At first, you might think it's the flu, and it could be, but hantavirus pulmonary syndrome could escalate. Here's what you need to know. According to the World Health Organization's disease outbreak news from the 2nd of May, 2026, and the active cluster aboard the Dutch cruise ship MV Hondius. Just to be clear, hantavirus is not the flu. Mortality across confirmed pulmonary syndrome cases runs from 30 to 60%. Anything less than needing supplemental oxygen would be unusually mild. Severe cases need a ventilator. Critical ones are defined by respiratory or multi-organ failure. The Hondius left Ushuaia, Argentina on the 1st of April with 88 passengers and 59 crew aboard. By early May, 7 of them had become symptomatic. 3 were dead. Let's break down what having hantavirus pulmonary syndrome actually looks like day to day. Hantavirus is carried in the urine, droppings and saliva of wild rodents, most commonly the deer mouse. You inhale it when contaminated dust gets stirred up. In the early days of infection, the virus invades the cells lining the small blood vessels of your lungs specifically. Those cells start leaking. Plasma, the watery part of your blood, escapes into the spaces around the air sacs. That's the whole disease in one sentence. Your lungs slowly fill with your own blood plasma. After exposure, you might feel completely fine for anywhere from 1 to 8 weeks. The Hondius's first patient, a 70-year-old man, had stepped off the ship onto Tristan da Cunha and Nightingale Island roughly 2 weeks before his fever started. Day 1 through 3 is when most patients first notice anything wrong. It feels like the worst flu of your life. Sudden high fever, deep muscle aches concentrated in the thighs, hips and lower back. About half of patients also get headaches, dizziness, chills, nausea, vomiting or stomach pain. No cough yet, no shortness of breath. Many people send themselves to bed thinking they'll sleep it off. On day 4, the fever holds, the muscle aches deepen. The Hondius's first patient reached this stage on the 9th of April, 3 days after his fever began on the 6th. Day 5 is the day everything changes. The damaged blood vessels start to leak in earnest. You develop a dry cough you can't quite place. Your chest feels tight. Your breathing speeds up without you noticing. In a hospital, this is when most patients are admitted. On the Hondius, there was no hospital, just the ship. Day 6 and 7 are the cardiopulmonary phase. They are brutal. The lungs fill with fluid. Oxygen drops. Your heart can no longer pump effectively against blood vessels that have lost their grip on their own contents. Shock sets in. Mortality is concentrated in this 48-hour window. The 70-year-old man on the Hondius died on the 11th of April, 5 days after his first symptom. For survivors, day 8 through 14 is the diuretic phase. Your kidneys slowly clear the leaked fluid back out. Breathing eases, the fever falls, but you are still very sick. Oxygen, intubation, kidney support. Most patients still need them for weeks. There is no specific antiviral approved for hantavirus pulmonary syndrome. Treatment is purely supportive. The Hondius is moored off Cabo Verde, still waiting for permission to disembark. If you have been around wild rodent droppings and develop sudden fever with severe muscle aches, do not wait for the cough. Get to a hospital, tell them exactly what you were exposed to.